What's up, everybody? You are listening to the Strength and Knowledge Podcast. I'm Dr. Zach Baker, and I have with me today Dr. Corrie Jones, and we're going to talk a little bit about lifting weights and exercising and answering a question that always comes up in the clinic, especially with students and new grads. And it is always, what is the best exercise to do with my patient? And as with almost every question you'll get, the answer is it depends, and it's probably context dependent. But in the world of exercise and fitness and strength and conditioning, there's a variety of different things that we can do with our patients, and it can be overwhelming trying to figure out, where do I start with this person? What do they need? What do they want? And what is going to give them the most bang for their buck? So if we have some sort of strategic way to go about answering this question and thinking through this question, I think as clinicians, it'll make your day a lot more streamlined, a lot less cognitively demanding, and you're just less mentally fatigued at the end of the day because you have some kind of automated responses. So, Corrie, I know a lot of people always ask, like, what should I start with my patient, or what should I do with my patient? Should I do isolated exercises? Should I do compound movement? Should I do single or multi-joint? How would you go about even answering that?
Yeah, so I would say isolated exercises or like single joint exercises are really useful whenever you are trying to restore range of motion. So if you have mobility limitations, some of the things that we think about there are using either light eccentrics or reciprocal or autogenic inhibition. So if you're using those things to restore range, sometimes it's super helpful to do really particular things and very specific things for that joint. Or if you've gained some of that motion back recently and you're like wanting to really rebuild that map in the brain, that homunculus, you want to really restore that to where the body recognizes that this joint has more range of motion. I think it's helpful to do some of these isolated activities where you're really zeroing in on one particular joint. Another thing that comes to mind is if you're really working on particular tendons or tendinitises, right? So we want to be direct in our application of some of these forces so that we can desensitize tissue. So sometimes that's another time where you're getting really isolated and you're zeroing in on one particular aspect. However, the body works together, right? So it's always going to be something that we have to coordinate joints and coordinate movement. There's regional interdependence, no matter what movement that you're doing. So the big thing there is not staying in isolated movement patterns. So yes, we can train them and use them right after getting a range of motion back. But then we also want to dive into, how does this fit into the whole system? How does it fit into a movement pattern? How does it fit into a squat, a hinge, a reach, a push, a pull? Some of those basic weightlifting words that you hear when you're training specifics in the gym. So always important to eventually get back to that global, because we also need to figure out neuromotor control when we're using that force. So you can train all you want, but if you don't know how to apply that force and apply that throughout an entire skeleton, then it's going to be really hard to actually have some of these functional movement patterns nailed down. So restoring that stability, restoring that strength, super important joint to joint, but then we got to throw it into a more global movement pattern to really translate into real life. So sometimes I feel like people often do that in the gym. What would you say, Zach, to somebody who's trying to dive into whether or not to use free weights versus maybe some of the machines of the gym? How would you talk about some of the similar things in relation to what to get after at the gym?
So I think there are instances where both can be highly beneficial. And whether it's in early phase rehab or later phase rehab, or whether you're trying to make things more simple or more difficult for them. The beauty of machines is that they reduce the degrees of freedom. They constrain movement, which sometimes you don't like that because you want them to be able to express movement a little bit freely. But if you have somebody that maybe coordination is an issue, or maybe stability is an issue, or maybe you don't want them having to worry about technique and you just want them to be able to put forth a lot of effort, machines are great for that. It constrains the movement, it puts them in a very predictable environment, and all they have to worry about is how hard they're pushing and how many times they need to push that weight. So it can be a very good way to simplify something so that they can just focus on the effort at hand. The other thing that machines do really well is they isolate. So if I have somebody who is a post-operative knee patient and I know that I need to get their knee extension strength better and their quads developed, well, squats are a good exercise for that. Lunges are a good exercise for that. Step-ups are a good exercise for that. But unfortunately, there's no way to definitively quantify how much the quads are actually contributing to that. And we know if we're doing more reps, we're doing more weight, then indefinitely they are getting stronger, but we can never truly put a number on it. But if I put them on a leg extension machine, I know the only muscle group that's going to be contributing to that movement is the quads. There's no way to cheat the system. There's no way to compensate. Or, I mean, if you find a way, you're going to look pretty goofy trying to do that. But it's a way to really isolate the quad, and you can definitively quantify and know, am I getting stronger? Am I moving more weight with this? Now, maybe we want to focus on something that is a little bit more proprioceptively challenging. Maybe we do want to give them a little bit more technical demands with the activity. Maybe we want them operating in space and having to show competency with high levels of intention and high levels of force when they don't have that inherent stability or kind of guided pathway that the machine provides. And this is where free weights really, really come in handy. Now, the one downside to that, the more movement that is allowed, there's more to coordinate, there's more to stabilize, there's more pieces to put together. So that could potentially limit the amount of force and intensity that they're able to operate at. If they have so much of their bandwidth and their energy going towards proprioception and stability, there's only so much left in regards to force production or force dissipation. But I think a lot of this comes down to, what do we think is the weakest link? And when we're looking at movements, and maybe somebody has an altered movement strategy, and we're trying to figure out, why is this person not descending steps well? They have a very stiff-kneed pattern. They're not flexing the knee. What do we think is contributing to that? Is it coordination? Is it strength? Is it apprehension? And that is huge when considering that. And I don't know if you have any thoughts there, Corrie.
Yeah, so that makes me think too, like when we're talking diagnostically, like trying to determine what muscles we need to might work into more or what movement patterns we need to move into more. One of the diagnostic things that we're doing is eliminating body parts. So exactly what you're saying. So if we are doing a squat that's involving almost everything, right? That's triple flexion, everybody's moving. If we want to see how the hip is particularly operating in that, let's eliminate some joints. So let's have them go to half kneeling. And now let's have them do a half kneeling sit back. It's still a squat pattern, but we've eliminated foot and ankle. So now we can see, what is the hip doing in this movement? Is it moving extra in the frontal plane? Is it moving very well in the sagittal plane? Do they have full range of motion and full capacity to load this joint? So it's interesting because it kind of comes back to that too. When you're in that free weight stance, you can just do a whole movement pattern to be functional, or you can diagnostically say, I need to zero in on who's really not paying their dues as far as this movement goes, who's not contributing. And so we can eliminate body parts by changing through those neurodevelopmental stages. So I need to go to either half kneeling, tall kneeling. I need to go way down to quadruped or spine supported and figure out who's not contributing. Then maybe we work directly into that joint again, boost some of that strength, and see if we can put the puzzle piece back into the puzzle where we're looking at functional strength again. So it's just, I think, really important, based on what you said, just to make sure that we're using both in ways that we can rationalize, right? So it's not like there's one better than the other, but it's almost context dependent and situational to say, this one's going to help me at this time because I'm after this particular muscle, or at this moment, I'm more interested in what's happening neurologically proprioceptive in a full movement pattern to see if we can coordinate and really load tissues adequately in order to generate more force. So interesting to kind of chat back and forth where each has their place.
Yeah, and I think that's important to note, is that each does have their place. And I think we have a lot of purists or absolutists that think one is superior to the other or one is necessary. And I think this highlights that there's a lot of different ways that you can accomplish the same goal. And there may be some where it's a little bit more advantageous to go at it with one approach, whereas another way you may want the opposite approach. So I think the take-home message is, be intentional, be strategic, and make sure you have a rhyme or a reason as to why you're doing what you're doing. And if you do that and you're tracking progress, you're probably going to get pretty good results. So, as always, Corrie, appreciate having you on here, sharing your words of wisdom with us. If you enjoyed this episode, please share, like, and subscribe. You are listening to the Strength and Knowledge Podcast. Have a great day.